Yes, so today Sakhisizwe is approaching the topic of reproductive health and safety. Lack of access to contraceptive materials is linked to a wealth of problems, most notably sexually transmitted diseases and unplanned pregnancy. This single issue can escalate quickly and lead to unsafe abortions, which can become life and death situations. In an effort to increase access to contraceptive materials, the Deputy Minister of Health, Dr. Sibong sêni Dhlomo, and the Eastern Cape MEC for Health, Ms. Noma, khosa, zana, Meth, led the official launch of self-care wellness vending machines that will carry a variety of oral contraceptives. Today, we're speaking with the National Health Department spokesperson, Foster Morehale, here to fill us in on the details. How are you today?
Good afternoon to you and good afternoon to your listeners, and thanks for the opportunity.
And thank you very much for taking the time to speak to us today. So, firstly, if you can just touch a little bit more on how did the idea of the self-care wellness vending machine come about, and what was the inspiration behind this initiative?
Yes, this concept, we see that it has worked in other parts of the world. So that's why as the country, we say, let's try to pilot this and see how far it can go in terms of increasing uptake of sexual reproductive health commodities and also HIV prevention commodities like your contraceptives. So we decided to say, no, let's pilot this in few provinces in this few machines, precisely because of high rates of unplanned pregnancies around the country, high rates of HIV infections, especially among young people. Because some of them, when we ask them, why are you not coming to the clinic to prevent, to get their contraceptives? Why are you not coming to clinic also to take their condoms and also forth? Then they give us different reasons about it. They will attend the school until late and we are staying far from the clinic and so forth. But not only young people, but also even the working class, people who leave home early in the morning and go to work, come back late in the afternoon. On weekends, they have to do other family and household duties. So we came up with this plan to say, let's try to see if this will not increase uptake to contraceptives and HIV prevention commodities. So that's why we said, no, we are going to launch this in the areas where there's a high rate of HIV infection and unplanned pregnancies, which in most cases lead to what we call illegal and unsafe termination or abortion.
Mm-hmm. So you raised the issue of accessibility, but can you elaborate on some of the other issues present in South Africa, especially the problem of adolescent pregnancy, that create a specific need for such a resource?
I didn't get your question.
I was basically saying, can you elaborate on some of the other issues present in South Africa, especially the problem of adolescent pregnancy, that create a specific need for this resource in South Africa?
Yeah, as you know that the currently, especially with regards to HIV infections, the HIV infections among young people is increasing in an alarming rate, especially ongoing the youth. So even though we have got the wellness clinics in all the universities, we feel surprised why are these numbers continue to go high. But also when you look at unplanned pregnancies and termination of pregnancies, this is high among young people, especially those attending at universities and colleges. So we ask ourselves to say, what is the cause of this? And we do have a dialogue and youth engagement with young people in an open environment where they are able to talk to us openly without any form of fear of judgment. That's why at our clinic we establish what we call youth zones, so that young people, when they go to the clinic, they don't join the queue with the rest of the general public, but they go to a dedicated site within our clinic where they get fed by young doctors, young nurses, so that they're able to openly discuss their health needs without any fear of being judged. Because some of them, they raise issues of judgmental attitude by our nurses and the healthcare workers in our facility. So we feel that through this one, it's easy for someone to just go and assess this prevention of HIV and pregnancy without interacting with anyone, but only through the call center.
And you still tune into Sakhisizwe, Building the Nation, Bodinasi. We are speaking to the National Health Department spokesperson, Foster Mohale. He's been talking to us a little bit more about the self-care wellness vending machine. So, Foster, based on all the, based on everything that you've mentioned up until this far, location is always the most important thing when you are implementing a new program and so forth. So taking that in consideration, so on the process of selecting the location for these vending machines, like what factors were considered and what has the feedback been ever since the pilot program has been implemented?
Yeah, also I need to emphasize that the pilot program is ongoing. We will continue to learn. We started in Pretoria, we are going to West, to go to Mpumalanga, Limpopo, Gauteng, and so forth. So far, we are launching this with 15 machines in 5 provinces. But also in terms of the reasons behind choosing the locations, it's a number of factors. Number one, it's accessibility of this machine to most people who are unable to go to our health facilities. That's why we say you're going to see them mostly in secure public spaces like, shopping complex, the malls, next to the stores or the shopping centers, next to the universities and the colleges, where most of these people that we are targeting, they are found. So we believe that this will help us to increase access to these health services and also improve uptake of these services. So far, I can't tell you in terms of the impact, because we are going to, after we launch all these of these wellness vending machines, we are going to, by the end of this year, we are going to conduct what we call the impact assessment study to check the impact of this in terms of the volume of people who come and collect it.
So can you take us through what is the current range of products available in these vending machines, and what are your plans to extend that in the future, if any?
Yeah, the outcomes of the impact assessment study will enable us to make a decision in terms of what is the next step. But our intention is that if we receive positive feedback, we aim to roll out this across the country in all these major areas, as I indicated, examples of shopping centers, colleges, universities, public libraries, and so forth. But in terms of what is the other question? What was the other question?
Yes, so the other question is, what are the current products available in the vending machines?
The current products are the same commodities, contraceptives that you find when you go to our clinics and hospitals in order to prevent in order to prevent pregnancy and also prevent the HIV infections. Exactly the same contraceptives that we find when you go to our health facilities.
And then thank you very much, Foster, for taking the time to speak to us today. So in conclusion, what message would you like to convey to the public about the importance of this initiative or initiatives like the self-care wellness vending machine in promoting sexual reproductive health and also preventing unplanned pregnancies? Because like you've mentioned earlier also, this is an opportunity for the youth to basically come into the healthcare facilities and to be able to have an honest conversation with the healthcare providers.
Yeah, now our message to young people, not only young people, but also even adults, to say, please, let's make use of this machine, which we believe is bringing convenience, especially for those who don't have time to go to the nearest facilities to get to collect these contraceptives and HIV prevention methods. So we're trying to make their lives easier so that they access this without going through a hassle, without waiting in a long queue just to collect this to protect themselves against HIV infections and unplanned pregnancy. So let's make use of this. Let's try to protect this infrastructure in order to make sure that it's going to benefit us in the future.
And just before I let you go, if we do speak about accessibility, where can people get more information on how everything works, and even if they maybe have more questions around the self-care wellness vending machine program?
They can just go to the nearest health facility to get more information about this machine. then they'll be able to get more information and on how and when you're going to roll out this machine. And also want to emphasize that these wellness machines, they don't display other methods of taking services closer to the people. People who are closer to the health facilities, they can still go to the health facilities instead of using the machine. So we were just bringing another option for people to access this very important sexual reproductive health facilities.
Thank you very much for taking the time to speak to us today. Any last words?
No, thanks for this opportunity to allow us as the department to raise awareness about this very important subject to the platform to say, in the future, consider us to allow us to empower our people with health information to make well-informed choices.
Thank you very much, Foster. Have a beautiful day further. Bye.
Have a wonderful day. Goodbye.
Bye-bye. Bye-bye.
And that was Foster Mohale, and he was just speaking to us a little bit more about the self-care wellness vending machine.
Yes, information is key. And so that was definitely an asset to hear more about what exactly these machines are, where they are accessible, and how they can help you in your personal life, and what are the larger outcomes of initiatives like this. So incredibly important. So thank you, Foster, once again.
So that concludes today's edition of Sakhisizwe Building the Nation Podinasi. So next up is the Afrikaans News at 2 with Mitchum George. Followed by that, we do have Back Chat. And then at 4, we have Everyday People with Larato. So from myself, Jasmine Roberts.
And from me, Nadia Trinidad.
Have an amazing Monday further.